The surgeon told me to step outside the trauma room. He did not say it gently. He said it in front of 2 residents, 3 nurses, a respiratory therapist, and a young soldier bleeding through the sleeve of his training uniform. "This is real trauma," Dr. Malcolm Pierce snapped, raising one gloved hand toward the doors. "I don't need a float nurse in my room." The word float landed first. Then nurse. Then my room. I was standing just inside Trauma 2 at Fort Mason Military Medical Center, wearing pale blue scrubs, a disposable gown, and the calm face I had spent years learning how to build over things that still hurt. My badge said, "ELENA Ward. RN, temporary staff." Temporary. That was what they saw. A woman in her 40s covering gaps in the schedule. A quiet agency nurse who stocked airway carts, changed sheets, answered call lights, and did not join the staff gossip because she never stayed anywhere long enough to be included. I looked at the patient on the bed. Young. Early 20s. Army. Sweating hard. Pulse too fast. Breathing shallow, but trying to pretend he was fine, because soldiers are trained to lie politely to pain. His chart said training accident. His skin said something worse. I took one step closer. Dr. Pierce blocked me with his shoulder. I sat outside. Behind him, Nurse Vale smiled down at the chart like she had been waiting all day for someone to put me in my place. One of the residents looked embarrassed. The other looked relieved. People love hierarchy when it protects them from thinking. I could have argued. I could have told Dr. Pierce that he was missing the pattern, that the soldier's pressure was not dropping from simple pain, that his shoulder position, breathing rhythm, and strange abdominal guarding did not match the story they had been given. I could have told him that I had seen this before. Not in a classroom. Not in a calm trauma course with plastic mannequins and clean gloves. In a place where lights failed, radios cut out, and the person who spotted the wrong detail first was the person who got someone home alive. But I did not say any of that. I stepped backward. I removed my gloves. And I stood outside the trauma room doors while the surgeon who had dismissed me kept working on the wrong problem. Because 15 minutes later, an Army colonel would walk into that hallway, hear my voice, and stop like the past had just reached through the hospital walls. He would look at me in my blue scrubs. Not at my badge. Not at the word temporary. At my face. And then he would say the name no one in that hospital knew. Nightingale 3. Before I tell you why that name made the entire trauma unit go silent, tell me this. If someone humiliated you in front of a room full of people, would you fight for respect immediately, or would you wait until the truth had witnesses? My name is ELENA Ward. I was 41 years old the day Dr. Pierce decided I was not qualified to stand in his trauma room. I had been a nurse for almost 18 years. 12 of those years had been connected to the Army in one way or another. Military hospitals, forward surgical teams, medical evacuation coordination, patient movement, trauma handoff, the strange invisible world between battlefield and operating room where survival often depends on the person who can read chaos faster than it can spread. But Fort Mason did not know that. To Fort Mason, I was an agency nurse on a 6-week temporary contract. That was how I wanted it. Temporary meant nobody asked why I never stayed for staff parties. Temporary meant nobody wanted my history. Temporary meant when the shift ended, I could leave through the side doors, sit in my car for 5 minutes with the engine off, breathe until my hands stopped tingling, and go home to an apartment where no one said my old call sign by accident. Nightingale 3. I had not heard it in years. Not spoken out loud. Not by anyone who knew what it had cost. At Fort Mason, the charge nurse was Donna Vale. She had been there 23 years and had turned that fact into a crown. She controlled assignments, breaks, personalities, and punishments with the same laminated clipboard. On my first morning, she looked at me the way people look at substitute teachers. "We're short," she said. "You're here to support, not lead." "I understand. Do you have trauma experience?" "Yes." Her eyes moved to my badge. "Agency trauma experience or real trauma experience?" I let the question sit between us. Then I said, "Both." She gave a small laugh. Not because anything was funny, because she had already decided the answer did not matter. "You'll stock rooms, help with vitals, move stable patients, and stay clear during major activations unless someone asks you in." "Understood. Dr. Pierce runs trauma." "I'll remember that." "You should." I did. Dr. Malcolm Pierce was the kind of surgeon who made nurses quiet for the wrong reasons. He was brilliant. I will give him that. Skilled hands, fast decisions, clean technique. He could stop bleeding with the confidence of a man who had been praised so often he had started confusing speed with wisdom. But he hated being questioned, especially by nurses, especially by temporary nurses. The first time I corrected him was on my third shift. Not dramatically, not in front of a room. He ordered a medication dose based on an estimated weight that was clearly wrong. I checked the chart, looked at the patient, recalculated quickly, and said, "Doctor, that dose may be high." He did not look up. "It's fine. It is high for his actual weight." He turned then. Slowly. The room noticed. "Are you pharmacy?" he asked. "No." "Are you the attending?" "No." "Then do your job." "I am." The pharmacist caught it 10 minutes later. The order was changed. Dr. Pierce never mentioned it. But after that, I became the kind of person he saw even when he pretended not to. That morning, the hospital had already been running hot. 2 training injuries from the base, a spouse with chest pain, a retired sergeant with shortness of breath who kept apologizing every time someone entered his room, a child with a broken wrist, 3 soldiers dehydrated from a ruck march that command insisted had been moderate difficulty, which meant someone had lied on paper. By noon, the ER smelled like antiseptic, cafeteria coffee, sweat, and the faint metallic edge of blood no cleaning product ever fully removes. I spent the morning doing what I had been told. Stocking, cleaning, moving, helping without being seen. There is skill in that too. Invisible nursing is still nursing. At 12:40, a private first class named Daniel Ruiz came in with dizziness and shoulder pain after what the intake note described as blunt impact during obstacle course training. He was embarrassed, which worried me more than his vitals at first. Embarrassed patients minimize. Soldiers minimize harder. He kept saying, "I'm good, ma'am." He was not good. His left shoulder sat wrong, but not like a simple dislocation. His breathing had a catch in it. His abdomen looked soft until he tried to shift, then his whole body tightened. His pulse was too fast for the amount of visible injury. His blood pressure had not crashed yet, but it was thinking about it. I watched from the hallway while Dr. Pierce examined him. "Shoulder injury," Pierce said. "Possible rib involvement. Let's get imaging and pain control." I stepped closer. "Doctor." He did not turn. "Not now. He's guarding left upper abdomen." Pierce sighed. The kind of sigh men use when they want a room to know a woman has become inconvenient. He fell on his shoulder. His shoulder may not be the problem. That got him to turn. Donna Vale looked up from the counter. A resident froze near the monitor. Pierce walked toward me with his voice lowered just enough to sound controlled and loud enough to humiliate. "Ms. Ward, you are temporary staff. You do not insert yourself into trauma assessments unless invited." I looked past him at Ruiz. The young soldier was watching us now, trying to pretend he was not scared. I kept my voice calm. "I think he may have internal bleeding." Pierce's face hardened. "You think?" "Yes." "Based on what? Your temporary intuition?" The room went still. Donna Vale smiled faintly. I felt the old reaction rise in my chest. Not anger. Precision. The dangerous kind. I said, based on shoulder pain with abdominal guarding after blunt trauma, tachycardia, increasing pallor, and his breathing pattern. Pierce leaned closer. This is real trauma. Step outside. That was when the room decided what I was. Some looked away. Some looked pleased. Some looked relieved it was not them. I stepped outside. Not because he was right. Because I had learned that people who worship authority often need disaster before they accept correction from the wrong mouth. I stood behind the glass doors and watched. Pierce ordered imaging. Pain medication. Basic labs. He did not activate massive transfusion. He did not call surgery yet. He did not push for fast abdominal ultrasound. He was treating what was obvious. The obvious thing is not always the thing killing you. At 13:05, the first radio call came through from base emergency transport. Another inbound from the training range. Then another. The unit had been running a joint field exercise with a ranger element and a medical evacuation drill. A training structure had partially collapsed. Multiple injuries, one critical, one unstable, one officer accompanying. The ER shifted into response mode. Donna started barking assignments. Pierce took over Trauma 1. I stayed near the supply wall because that was the lane I had been given. The ambulance bay doors opened at 13:17. Two medics rushed in with a soldier on a gurney. He was conscious but fatting, one hand pressed hard against his side. Behind him came another soldier limping with help, then a third on a stretcher, pale and shaking. Last came the colonel. Tall. Silver hair. Field uniform dusty at the knees. Jaw locked tight. His name tape read HAYS. The sight of him hit somewhere deep and old. Not recognition yet. A warning. There are men you do not know, but your body remembers their type. Commanders who count exits, casualties, and lies in the same breath. Donna moved toward him. Colonel, we have your men. Dr. Pierce is trauma lead. The colonel looked past her into Trauma 2, where Ruiz had started to deteriorate. Where is the nurse, who said abdominal bleed? Every head turned. Mine did too, but slower. Pierce stepped out of Trauma 1, irritated. Colonel, my team has this under control. The colonel did not look at him. He was scanning the room. Someone called it before transport updated us. Who? Donna's face tightened. No one official. Temporary staff made a comment. His eyes found me. I was standing beside the airway cart with a box of suction tubing in my hands. Blue scrubs. Temporary badge. Hair pulled back. No rank. No patch. No reason for him to stop. But he did. His expression changed in a way so small almost nobody would catch it. I did. He took one step toward me. Say something, he said. Pierce looked offended. Excuse me. The colonel ignored him. His eyes stayed on me. Your voice, he said. Say something. The room went very quiet. I should have stayed silent. That was the plan I had built my life around. But from Trauma 2 came the monitor alarm. Ruiz's pressure dropped. Hard. His skin changed from pale to gray. His breathing hitched. Dr. Pierce turned toward the alarm. For 1 second, everyone froze. That is the moment that separates trained rooms from frightened ones. I set the tubing down. Get ultrasound now, I said. Pierce snapped. I did not ask you. Now, I said. Not loud. Not emotional. Command voice. The colonel's head lifted. Pierce stared at me. The room felt the shift before it understood it. I stepped into Trauma 2. Donna grabbed my sleeve. I looked at her hand. She let go. Ruiz's eyes were unfocused. His pulse was rapid and weak. The resident was fumbling with a blood pressure cuff as if the cuff might explain the room to him. I moved to the side of the bed. "Daniel," I said. His eyes flickered. "You know my name. It's on your chart. Stay with me." He tried to breathe through pain. "Shoulder hurts." "I know. That's not what worries me." Pierce came in behind me. "You are out of line." I looked at him. No, his spleen might be. That shut the resident up. The colonel stepped into the doorway. His eyes never left my face. "Nightingale 3, he said. The call sign entered the room like a blade through cloth. Clean. Sudden. Impossible to ignore. My hands stopped moving for half a second. Donna looked at me. Pierce frowned. "What did you call her?" The colonel took one step forward. "Nightingale 3. No one spoke. My throat tightened. I had buried that name under contracts, agency shifts, apartment leases, grocery lists, and 3 years of pretending I did not wake up counting patients in the dark. But buried is not the same as gone. I looked at Colonel Hayes. "You were at Kestrel Ridge," I said. His eyes softened. "You kept my evacuation board alive." I shook my head once. "Not now." He nodded. "Good." He understood. The patient came first. I turned back to Ruiz. "Fast scan," I said. The resident moved. Pierce stood rigid for half a second, then snapped, "Do it." That was his first useful decision in 10 minutes. The ultrasound probe hit Ruiz's abdomen. Free fluid. There it was. Not subtle now. Pierce's face changed. "Page surgery," he said. "Already should have been done," I said. He looked at me. I did not look back. "Activate massive transfusion," I continued. 2 large-bore IVs. If the left line fails, go IO. Keep him warm. Call OR and tell them probable splenic rupture after blunt trauma with unstable pressure. Do not wait for CT. Donna moved faster than I had seen her move all day. Trina, one of the younger nurses, grabbed blood tubing. The resident found his voice. "Pressure is 78 systolic. Trend. Dropping. Then move like it." The room moved. This time correctly. Pierce worked fast once the right problem was in front of him. I will give him that too. Pride had delayed him, but skill took over when denial ran out of space. Ruiz grabbed my wrist. "Am I dying?" "No," I said. Pierce glanced at me. I ignored him. Ruiz's grip tightened. "You sure?" "No," I said, "but I am not letting you do it in this room." The young soldier gave a broken laugh that turned into a groan. "Good enough. We got blood started. We kept him warm. We moved him. Surgery took him. And for the first time since I entered that hospital, nobody told me to step outside. When Trauma 2 emptied, the room did not relax. It hovered. There was blood on the floor, wrappers on the counters, the ultrasound machine still humming, the smell of sweat and adrenaline in the air. Colonel Hayes stood in the doorway. Dr. Pierce stood near the sink, stripping off gloves with more force than necessary. Donna stared at the board. The residents looked at me like I had changed shape. I had not. That was the point. I had been the same person when I stalked the cart. The same person when Pierce dismissed me. The same person when Ruiz was still salvageable. They were just late to the information. Colonel Hayes stepped into the room. "Captain Ward," he said. I closed my eyes briefly. Donna whispered, "Captain." I opened them. "Former," I said. Hayes corrected me gently. "Still earned." That hurt more than it should have. Pierce looked between us. "You know her." Hayes turned to him. "I know she kept 32 wounded personnel moving through a failed evacuation chain when our communications collapsed. I know she caught an accountability error that would have left 2 men behind. I know she worked 18 hours with a fractured wrist and refused treatment until the last transport lifted. The room went silent. The kind of silence that makes people review every word they said earlier and wish language came with a delete button. Pierce looked at me. For the first time, really looked. Hayes continued. We called her Nightingale 3 because when the board failed, everyone waited for her count. Donna's clipboard lowered slowly. Trina covered her mouth. One resident whispered, "Oh my God." I hated that part. Not because it was untrue. Because people mistake history for permission to stare. I removed my gloves. Ruiz is not stable until surgery confirms control, I said. Hayes smiled faintly. Still counting. Always. Pierce cleared his throat. Ms. Ward. I turned to him. Captain Ward, Hayes said. Pierce swallowed. Captain Ward, he repeated, and the words sounded like they had cost him something. Good. I was not aware of your background. No, I said. You were aware I was a nurse. That should have been enough. No one breathed for a second. Pierce looked down. It was not an apology. But it was the doorway to one. The next hour passed in fragments. Ruiz made it into surgery. The second soldier needed imaging, but remained stable. The third had a concussion and 2 cracked ribs. The officer with the limp refused pain medication until Colonel Hayes threatened to personally write him up for stupidity, which was the most efficient medical intervention of the afternoon. I kept working, because work was easier than being seen. Donna gave me the trauma board without speaking. Trina brought me supplies before I asked. Pierce stopped arguing when I corrected a note. The ER began to function like a team, because suddenly everyone was willing to listen to the temporary nurse. That should have felt satisfying. It mostly made me tired. Respect that arrives only after proof can still save lives. But it does not erase the insult that came before it. At 15:42, Ruiz came out of surgery alive. Splenic rupture confirmed. Internal bleeding controlled. Surgeon said fast catch likely saved his life. Fast catch. Such a clean phrase. It did not mention the 10 minutes we almost lost to arrogance. Colonel Hayes found me in the supply room after the update. Of course he did. People like him always knew where to find people like me. I was counting trauma packs. Not because anyone asked. Because counting things calmed me. You disappeared, he said. I changed jobs. You disappeared. I placed another pack on the shelf. I got tired. He stepped inside, leaving the door open. Smart. Respectful. I heard you were medically retired. Medical board language is always polite. What language would you use? I looked at my left hand. The old injury had started to ache after the adrenaline dropped. I would say my body resigned before my guilt did. Hayes said nothing for a while. Then, that sounds accurate. I almost smiled. Not because it was funny. Because he did not insult me by rushing to comfort. He reached into his jacket pocket and took out a small cloth patch. Faded. Folded. Old. A white bird wing stitched above the number 3. My breath caught. Where did you get that? Major Ellison gave it to me before she retired. Ellison. The field surgeon from Kestrel Ridge. The woman who had once told me, if you keep trying to be the last person standing, eventually you'll be standing in a room full of ghosts. I had hated her for being right. Hayes held out the patch. She said if I ever found Nightingale 3 pretending not to know her own name, I should give it back. I stared at it. People need to stop predicting me. She also said you would say that. This time, I did smile. A small one. Painful. Real. I took the patch. The fabric was soft from age. For a second, The supply room vanished and I smelled dust, antiseptic, burned plastic, and rain on canvas. I closed my fist around it. I am not going back, I said. I did not ask you to. Good. I am asking you not to erase what made you. I looked at him. That is not a small ask. No, he said, it is not. Outside the supply room, Donna appeared and stopped when she saw us. Her face had changed. Not friendly. Not warm. But stripped of certainty. Ruiz is asking for the nurse, she said. Hayes looked at me. I sighed. Of course he is. Ruiz was awake enough to be difficult and drugged enough to be honest. When I entered recovery, his eyes opened halfway. You were right, he mumbled. Usually. He tried to smile. Don't tell the surgeon. I already did. He winced. Am I in trouble? Only if you apologize for bleeding on our floor. His smile widened slightly. Then he whispered, Colonel said you were Nightingale Three. I checked his line. I was. Sounds important. It was a call sign. Were you important? I taped the line down more securely. Then I looked at him. To the people who needed me, yes. He nodded like that answer made sense. Then he fell asleep. When I came back out, Dr. Pierce was waiting near the nurse's station. He looked uncomfortable. Good. Growth often does. Captain Ward, he said. The ER got quieter. Donna pretended to chart. Trina did not even pretend. Pierce took a breath. I was wrong to dismiss your concern. Yes. He blinked. Maybe he expected me to soften it. I did not. He continued. And wrong to speak to you the way I did. Yes. Another pause. I apologize. I studied him for a moment. Apologies in hospitals can be performances too. This one looked painful enough to be useful. Apology accepted, I said. His shoulders loosened. But, I added, do not only change because I had a call sign. The next nurse you dismiss might not have a colonel nearby, and she might still be right. That landed. He nodded slowly. You're right. Yes, I said, that has been established today. Trina coughed to hide a laugh. Even Donna looked down quickly. The rest of the shift moved differently. Not magically. People do not become better in one afternoon. But they became more careful. Donna asked instead of ordered. Pierce listened before interrupting. The residents started checking with nurses before assuming the chart told the whole story. At 18:30, a medic brought in coffee from the officer's lounge and placed 1 cup beside me. I looked at it. What is this? He shrugged. Colonel said Nightingale 3 takes coffee black. I looked across the room. Hayes stood near the entrance, speaking with a base liaison. He did not look at me. He did not need to. I took the coffee. It was terrible. Military coffee always is. I drank it anyway. At 19:05, my shift ended. I changed in the locker room slowly. My hands hurt. My back hurt. My head hurt from being looked at too much. The patch sat on the bench beside my bag. Nightingale 3. I had spent years trying to become Alina Ward, temporary nurse. No history. No legend. No one asking me to be calm while everyone else fell apart. But the truth was, I had not stopped being Nightingale 3 because I stopped wearing the uniform. I had only stopped letting other people say the name. There is a difference. When I stepped outside, the evening air felt cold against my face. Colonel Hayes was waiting near the ambulance bay. You do this often, I asked. Wait outside hospitals for nurses who avoid conversations. Yes. Only the stubborn ones. I tucked my bag higher on my shoulder. Ruiz will live. Yes. The observer. Stable. The others, angry, embarrassed, and alive. Good. He nodded. Then he saluted. Not big. Not for anyone else. Just enough. I returned it. This time, I did not hesitate. The next morning, I came back to Fort Mason. Temporary contract. Same badge. Same blue scrubs. Different room. Donna looked up when I walked in. Trauma 2 is yours today, she said. I raised an eyebrow. Mine. She swallowed. Assigned to you. Better. Pierce passed behind her, holding a chart. He stopped. Morning, Captain Ward. The nurses' station froze. I looked at him. Morning, Dr. Pierce. No drama. No speeches. Work continued. That was the real victory. Not the salute. Not the shock. Not the colonel saying the name. The real victory was the next day, when a nurse spoke, and the room listened before someone almost died. People love the moment of recognition. They love the powerful man walking in, the old call sign, the stunned faces, the apology that comes too late. But the work is not in the reveal. The work is in what changes after. The next patient. The next warning. The next quiet voice at the edge of the room saying, something is wrong. The question is whether anyone listens before the proof becomes a body. Dr. Pierce kicked me out of trauma because he thought I was only a temporary nurse. Donna Vale smiled. The residents looked away. I said nothing. Then Colonel Hayes walked into the trauma hallway and asked for Nightingale 3. The room went silent. And for the first time in years, I realized I had not lost the person I used to be. I had carried her quietly, waiting for the day someone needed her name again.